Can an L4-L5 disc herniation heal itself? Can an L5-S1 disc herniation heal itself? I'll answer this question immediately in a few seconds, but the reality is this video is for those people where they're not experiencing immediate relief or healing of their L4-L5 disc herniation or disc bulge, or L5-S1 disc herniation or disc bulge. So keep watching. Now, the truth is that your body has the ability and the mechanisms and the immune cells to actually begin to heal a herniated disc or a bulging disc, especially if it's inflamed and irritated and causing pain, within 6 to 8 weeks. And in most cases, that's gonna happen. However, my concern is for the people that are experiencing chronic injuries, chronic pain, back pain, chronic buttock pain, chronic leg pain, chronic sciatica pain from their disc injuries. What I mean by chronic is 6 months or longer, 9 months or longer, a year, 2 years. And I'm gonna give you the missing piece that most people don't even realize that could be the reason why they have a chronic pain or chronic situation when it comes to the recovery of their L4-L5 disc herniation or L5-S1 disc herniation. Now, I've been seeing thousands of patients in my office in the last 24 years of clinical practice. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. I'm advanced certified in chiropractic biophysics. My name is Dr. Walter Salubro. Go check out many of my other videos where I talk about many of these things. However, the one most important missing piece that I've seen in patients that have come to my office that have done a bunch of therapies in other places, all sorts of therapies, injections, medications, they've done all sorts of tests, they've done therapies, they've done exercises, sometimes chiropractic adjustments, even acupuncture, massage, and those things are all good, they have their merits, but the one thing that these chronic disc herniation patients have is that they got missed in the assessment of their full spine alignment from the front and the side with x-rays in the standing erect position. Why it's important? Because you can get an enormous amount of information about the structure of the spine from top, head, mid-back thoracic to lumbar pelvic region, and also looking at the posture. And in many cases, these lower lumbar disc herniations, like L4-L5 disc herniations or L5-S1 disc herniations, are a result of multiple alignment problems. And I'll give you some examples, just using a spine model over here to give an awareness of this. And if you haven't had a full spine x-ray from neck to mid-back to lumbar pelvic region, so full spine from the front and the side, and you have a chronic disc injury or chronic disc problem that's been lingering for over 6 months, and in my opinion, any amount of weeks is a long amount of weeks, but 6 months becomes chronic, and there's gonna be scar tissue developing, and the healing process is now prolonged and elongated, which is not necessary. So 6 months, 9 months, a year, or 2 years, then you need to get a full spine analysis to see if anything has been missed. So let me give you some examples of what I'm talking about, okay? So I have a spine here, okay? So just very simply, we know the spine should be straight from the front, right? Straight from the front, and then have these natural curves from the side, okay? So the lumbar spine is elliptical in shape, the thoracic spine is elliptical going forward, lumbar spine is elliptical going backward, and the neck is circular, all right? So we look at the full spine assessment, right, just like this. So let's say someone standing like this has upper thoracic bending forward, head bending forward. Look what happens to the lumbar spine. It's now being affected. What if someone's thoracic spine is going backwards like this? Look at the lumbar spine, it's being affected, right? What about this position, right? So from the front, what if their spine is going this way? The lumbar spine is being affected. What if their spine is going this way? The lumbar spine is being affected. What if there's an anatomical short leg and there's a pelvic tilt, right? Or the spine's tilting that way? What if there's a scoliosis, right? What if there's a reduction in the actual alignment of the spine or an increase in the actual curvature of the spine? So these are all things that we can get information from when we're looking at a full spine x-ray. So the most important thing I can impress upon you today is if you haven't had a full spine structural analysis and measurement of your spine from the front and the side, then you need to. If you need help finding a designated, focused, corrective care type of doctor, like a corrective care chiropractor, then just comment below and I'll send you to an online directory where you can see a list of chiropractic biophysics doctors like myself that are trained, certified. Hopefully you can find someone in your area. Just type in your zip code or postal code, many across the United States, in Canada, and some in other parts of the world as well. But just comment below and I'll send you that doctor directory and hopefully you can get a full spine assessment. The last thing I want is for people to be suffering of disc injuries for many months that become chronic and now have this limiting, debilitating disability because of their disc injury and disc herniation. Okay, so in many cases, yes, you're gonna get healing in the first 6 to 8 weeks, but my concern is when it becomes chronic beyond that. Something has been missed, because if you still have pain and injury and low back pain and leg pain and numbness and tingling beyond those 6 to 8 weeks, something got missed. So you need to get this evaluated. And I'll almost be certain that if you had your spine checked fully from top to bottom, standing in an erect position, and look at the full spine alignment from top to bottom, front and side, that you might catch some issues. And now you can start working on the corrective methods to improve those alignment issues and take the abnormal pressures and loads and weights on those discs and now give it a chance to heal and give it a chance for the body to do what it needs to do, those cells, to break down the disc that's injured when the spine is properly supported and it's maintained proper posture, okay, and alignment. So that one thing that's been missed is the full analysis of the spine on x-ray, and of course the correction that follows that. If you found this valuable and you learned something, do comment below and let me know. Let me know about your struggles that you've experienced with your disc herniation and disc injury, what's worked for you and what has not worked for you. And then go check out this video over here if you want to learn more about the anatomy of a disc, some exercise that may help support the process for you right over here.